Are you dealing with ongoing fatigue? Can't figure out what's going on with your body, causing you to have decreased exercise tolerance, not having any motivation, not wanting to do things, just feeling really tired? My name's Dr. Taranella, and in this video, I'm going to break down some of the common causes of fatigue. We're going to look at each system of your body and how that can contribute to fatigue. This is kind of a broad overview of the causes of fatigue, and in subsequent videos, we're going to look at more details on the common causes of fatigue. So if you like this kind of information on health, nutrition, understanding your health on a deeper level, click on that like button and don't forget to subscribe to the video to get more videos like this one. Now for a quick disclaimer. The information contained in this video is for informational purposes only. It is not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or a medical professional. It should be used as an educational guide to deepen your understanding of health and treatment success. If you need medical attention, don't delay in seeking that treatment. All right, let's look at the common causes of fatigue. Fatigue is such a common cause for people to seek medical attention. And in this video, I want to look at some of the common causes of fatigue. We'll look at some of the categories, broader categories of fatigue, and we'll get into some of the specifics. And in other videos, I'll look at even more detail on some of the secondary causes of fatigue. We can put common causes of fatigue into three separate categories. The first cause is going to be physiologic. And with physiologic fatigue, it's basically like you're exerting too much or you're not getting enough rest. So if you're working increased hours, maybe you're doing heavy labor, doing some moving or something that your body's just not used to, maybe a new workout routine, that can definitely cause fatigue. And it's usually short-lived. Once you rest enough or your body recovers enough, that fatigue should go away. Another thing with that is maybe you're just not sleeping enough. You're going through some acute stress and it's interfering with your sleep. That can also cause fatigue. That's considered a physiological cause of fatigue. Secondary cause of fatigue is when there is something going on, medically speaking, like anemia or something we can physically point to that's definitely causing that fatigue. And then the third type of fatigue is chronic fatigue. That's usually going to be fatigue that lasts longer than a few months, even up to 6 months is usually when it starts to be categorized as chronic fatigue. And part of that is you're going through and trying to rule out any known secondary causes of fatigue. And if you go through the overall list and you're not able to find a secondary cause of fatigue, oftentimes you're put into this chronic fatigue category. The problem is many times people don't get a thorough evaluation for all these secondary causes. They get a basic blood panel, a basic evaluation, questioning, and if they're not able to find an answer, if your doctor's not able to find an answer in a very rudimentary way, looking at your labs and questioning, then typically you're going to be categorized as having chronic fatigue. Now, I say this because I have many patients that I look at their labs in more detail and they're said to have chronic fatigue, and we're able to find secondary causes of their fatigue. And so in those cases, they actually don't have chronic fatigue. They just have an underlying medical condition that's causing that fatigue. Now, there's obviously other cases where it's not as clear and it does take long-term investigation and treatment in order to relieve the fatigue. But I wanted to point out, give you an overview of some of those secondary causes of fatigue, just so you have knowledge of that. So, and they basically go through all the systems of your body. So they can include things like endocrine issues and hormonal issues. So if you have hypothyroid, not enough cortisol, not enough female hormones or male sex hormones can definitely cause fatigue. And depending on your age, that may be more or less likely. Diabetes can also cause fatigue when you're not getting the blood sugar into your cells. You're not going to be able to make energy. High insulin levels can also cause fatigue. So there's various endocrine or hormone-related causes of fatigue. There's also anemia and vitamin deficiencies. Sometimes just, you may not even be actually anemic, but you can have low iron levels or low B12 levels, and that can definitely cause fatigue. There's immune system problems and chronic infections. So just think about the fact when you're acutely sick with like an upper respiratory tract infection, you don't really feel like doing much. That's your body telling you need to rest so that your immune system can fight this off. Sometimes people have chronic infections going on, whether it's a urinary tract infection or something going on deeper in their digestive tract. These things can cause ongoing fatigue that's not resolved. It may go away short term and then come back. And that's an indicator that there's something going on with your immune system. Even cancer, which is also related to your immune system, can cause fatigue. Many autoimmune disorders like lupus and rheumatoid arthritis, because of the immune involvement, also can cause fatigue. And it's that increased immune activity that causes your body to want to slow down, even though in this case, it's not fighting off an infection, it's fighting your own body. It's the same chemicals that are being produced that cause you to be feeling like you have not enough energy. There's, of course, psychological causes of fatigue. Low motivation, lack of interest in doing things, lack of interest in the world is a subtle form of depression. So mild mood disturbance or even more severe major depression can cause someone to feel more fatigued and have lack of energy to do things. With mood disorders and fatigue, it's important to figure out which is going on. If it's a chicken and egg thing, sometimes it's not clear, but the low energy can definitely cause depression, and depression can sometimes manifest as low energy, lack of interest. Sometimes mood disorders like anxiety can cause problems with sleep disturbance, and that can also lead to lack of energy. And it's really, the underlying chronic sleep disorder that's doing this. Sometimes people say, well, I've had sleep problems my whole life. I only sleep 6 hours, and that's been fine for many years. So if it's, a long-term sleep issue where you only get 6 hours of sleep, that's one thing. But if it's a more short-term, like 1 to 2 years, and that onset of sleep disturbance correlates with your fatigue, then that's something you want to look at more carefully as well. Many times digestive disturbances, whether it's an autoimmune type of digestive issue like irritable bowel disease, Crohn's, or colitis, those things can definitely cause fatigue for the autoimmune standpoint. But also there's, IBS-like symptoms, post-infectious IBS, SIBO, other chronic digestive issues can kind of pull down your energy. One, because you're not absorbing things, but just the overall pain and discomfort can cause your mood to be disturbed and also lower your energy. Of course, when it comes to energy production, you need oxygen to be delivered to your tissues. So any cardiovascular problem is not going to deliver the blood to the tissues. So the tissues aren't going to have enough oxygen to produce energy through oxidative phosphorylation, which is how our bodies generate energy. Same thing could be said for any chronic respiratory issue. If you have COPD, asthma, things like that, that can cause fatigue due to lack of oxygen being delivered to those tissues. So there's lots of different secondary causes for fatigue. This is just kind of tip of an iceberg, kind of look at some of these things. There's much more in-depth things and more subtle things that can be going on with your body that can be looked at. And in subsequent videos and in other videos, we're going to look at other common causes of fatigue that are often overlooked or not investigated thoroughly enough. So if you have chronic fatigue or ongoing fatigue issues, you'll want to look out for those videos. Okay, that should give you a better understanding of the common causes of fatigue. If you do have questions about the content of this video, definitely check out the subsequent videos coming up on chronic fatigue. But if you do have a question, drop it in the comment section because I may do a separate video on that specific topic. There's a lot to cover on fatigue, so make sure you check out the upcoming videos that go into this in more detail. Thanks again for watching. We'll see you next time.